We're going to start the recording. The recording started. Welcome, licensed providers. We are so excited here at the DBHDS Office of Licensing to present to you today the Connect Provider Portal. My name is Robin Maitland, and I am the Quality and Data Inspection Manager for the Office of Licensing and the champion of our new licensing system, Connect. I would like to introduce you to who's here with me as part of the key business leaders in the Office of Licensing, and I'll begin with our director. Jay Benz is our director of Office of Licensing. Oh, that's okay.
I couldn't unmute myself. Hi,
Okay.
everybody. This is Jay Benz, the director for the Office of Licensing, and I'm so pleased that everyone was able to get on and attend this training today.
Thank you. Emily and Veronica.
Hi, yes, my name is Emily Bowles. I'm one of the Associate Directors for the Office of Licensing.
And Veronica may be having also mute issues. Veronica Davis, who is also our Associate Director. And then Angelica and Stella, will you please introduce yourself?
Yes, this is Angelica Howard. I am the SIU Manager for the Office of Licensing.
Good afternoon. I'm Stella Stith. I'm the Incident Management Manager within the Office of Licensing.
Thank you. We also have Chesna Gore on with us, as well as Melinda Roberts, who is over our background investigation unit. Thank you, all of us. So we are partnered with our vendor, GL Solutions, who is not online with us today, but they're responsible for the design and delivery of the Connect system and will be our partners. All of us are committed to the successful transition of you as licensed providers to using the Connect portal. Next slide, thank you. Today's presentation is being recorded. We do ask that you mute your microphone and turn off your camera, and we have disabled chat for purposes of today's session, given the size of the audience. However, we do expect you will have questions, and we have enabled the Q&A. If you look in your Zoom window at the bottom, there's a Q&A I guess icon that you can click on. What we do suggest, since this is, we've already run this session several times, we do have planned questions at the end of this session that we will not only are prepared to share with you those questions, but also send those to you along with this entire presentation to all the attendees on this call. We will be posting in the next week the recording of this, as well as the PowerPoint, so that you will have that to share with your organization. So we do suggest you may want to hold your questions until the end, but certainly as you do have questions, please write them down and be prepared to give those to us. So what are we going to cover today? We are going to just recap a little bit on October 5th. You were sent a memo talking about the go live of the Connect licensing system and some of our ways of doing business or expectations from the Office of Licensing have changed for our providers. So we're just going to recap that briefly, as well as our main goal today is to walk you through how to register and get into the provider portal. So we're going to do that. We're going to take the steps to do that. We have some videos to share with you, which is part of our training suite that we offer our provider portal, our providers, and we'll show you that as well. We're going to review the provider dashboard. What are you going to see when you first log in? And then also some of the things that we have designed in the functionality for you to manage your portal for your additional users, as well as getting background check contacts set up. And then for the remaining portion of today's session, just because of time limitations, we're going to highlight some other very important features, just we will not do a deeper dive in those today. And you can look forward to more training that we're going to provide for you in the future. So with the launch of a new licensing system, the Connect Provider Portal offers the DBHDS license provider the opportunity to conduct business online directly with the Office of Licensing. Some of the key changes that now allows for is that license renewals are now automated. The Connect system will notify all license providers 90 days prior to the license expiration date. You will get an email as well as a communication in the portal to let you know your license is up for renewal. The expectation is that you, the provider, will submit the renewal application online along with a proof of your state corporation commission or your SCC certificate that's valid. And you would send that to us through the Connect portal. We're basically paperless. Service modifications. The provider would submit a service modification through the Connect portal. In our previous legacy system, we had one paper application for all service modifications. You're gonna find when you get into Connect that we've organized service modifications into 4 discrete menu options. You're gonna have a service modification, which is when you want to add a new service. You're gonna have a location modification when you wanna add a service location to an existing license. And then you will have an information modification for miscellaneous types of org changes or something like a bed capacity for a particular location. And then the children's information modification is very similar. Licensing reports. For licensing reports issued after inspections will be issued through Connect and viewable through the Connect portal. The licensing reports are viewable whether there are no violations or there are actually citations associated with that license report. Providers are required to submit their corrective action plans through the Connect portal for all license reports issued with citations. Providers can also view and print CAT reports online. Providers can view the HIPAA forms online. So this is all functionality that will be available to you. And we'll look a little closer at this as we proceed in the presentation. Very important to note, for CRIS incident reporting, there are no key changes in requirements for providers to log into the CRIS system for serious incident reporting. The system location and the requirements to access CRIS have not changed. The late reporting citations that may be issued associated with incident reporting are now also issued through the provider portal and are viewable through the Connect portal for corrective action plan response. Any additional requirements that may result from Connect and CRIS now coming online will be addressed in forthcoming trainings that specifically target the CRIS incident reporting and the events that are prepared for you for that topic. Okay, we're going to go look now at the functionality and then what you need to do to actually get into the provider portal. We'll start with a video.
To request a login for access to the Connect Provider Portal dashboard for your organization, select the Request Login button on the login page. It is important to note that your organization may have already invited you to sign into the Connect Provider Portal. If you have received an email with a temporary password directing you to sign into the Provider Portal, you do not need to click the Request Login button. You may simply sign in with your email address and that password. You will be prompted to reset the password after signing in. If you attempt to sign in with the temporary password and receive an error that your temporary password has expired, you will need to select the Request Login button and follow the next steps in this video to receive a new temporary password. When you click the Request Login button, you will be directed to enter the information for your organization and for yourself. Fill out the information, then click the Submit button. If you do not know the information for your organization requested on this screen, you will need to contact your organization and request it. After submitting your login request, you will be directed back to the login screen. Please allow 3 to 5 business days for your request to be processed. Once approved for access to the provider portal, you will receive an email with a temporary password. At that time, return to this login screen and sign in to reset your password. Your temporary password will expire in 48 hours. If that happens, you will need to complete the steps to request a login again. If your request for access is denied, you will receive an email informing you of the denial. If denied, please contact your organization for additional information.
Thank you. So we're going to just walk through these steps again. The video that you just watched is going to be available to you as a provider. It's one of our training videos, but there are some additional steps we're requesting inside of the launch, and we're now in the launch week. So the first item right there, attend required training. We've requested all providers to attend training, so thank you for being here. This next item, provider sends the name and email of the main authorized contact to the address specified in a memo sent on October 25th. So many of you providers have done this. We have your main authorized contact that you said is going to be authorized to be the first provider user to access the portal. If you have not done that as of today, you can go ahead and do that. And we're waiting for all providers to really give us the main authorized contact. Once you complete this training, the main authorized contact will receive an email invitation. And in that invitation, you will actually have the specifics required to go to the website and then do exactly what that video said, request your login. When you request your login, it will be received by the Office of Licensing. We're going to validate that who is requesting access to the provider portal is in fact the name of the person that was authorized by the provider to be the main authorized contact. And we will validate you, and you will receive a temporary password to log into Connect. At that point, once you log into Connect, Connect will ask you to set your password, your permanent password, as well as your security questions, and then you're going to be in. This last box in this list is really once you're in as the main authorized contact. We do request that you review the video trainings, so we'll show you and walk you through that, as well as set up any additional provider users for the portal. We do expect that you have more than the main authorized contact who will need to have access to the portal, as well as setting up background check contacts. And we're going to go through all of that in this session. What I'd like to do is ask Emily to please reiterate anything that's important for these steps.
Hi, everyone. This is Emily Bowles, and this is our third time conducting this training. So we've identified a few FAQ that I think would be helpful to address now versus waiting towards the end of the training. So if you are a provider organization who is waiting to get logged into the Connect system, or your provider staff, and you're not sure whether or not your organization has sent the necessary information, the first thing I would do is I would make sure that the authorized contact for your organization has not already sent an email to our organization requesting login. We have received several duplicates from agencies, and then we have to weed through each of them. And so the more requests we receive and the more manual work we have to do, the longer it takes us to get each and every provider logged into the system. I will say that at this point, we've received authorized contacts from over 900 providers. So it's very likely that your organization has submitted the necessary information. So please confirm that somebody has not already sent the information before you do. If you determine that we have not received the necessary information from the authorized contact, you will need to send an email to licensing admin support at dbhds.virginia.gov. That's the email account listed here on this slide. And there are 3 required elements for this email. The first is the name of the provider organization. The second is the organization number. Please note that this is different from your NPI number, specifically your DBHDS organization number. And the third thing we need in that email is the name of the authorized contact and their email address. The 3 elements: the name of the organization number, and the authorized contact with their email address. It's also important to note that this email needs to be received from someone who was previously an authorized contact in our licensing system, OLIS. If it comes from somebody that wasn't previously an authorized contact, we have to stop the process and start calling the previous authorized contacts to determine if we can grant access. So this is also something that slows the process. A few other additional caveats. If you are someone who is currently on the waiting list, there's no action needed from you at this point. People who are on the waiting list will receive an email when they're pulled off of the waiting list requesting for them to log in to connect with login instructions. So if you're an applicant right now who's on the waiting list, no additional action is needed from you at this time. The second group of people is policy reviews, people who are in policy review. If your application is currently under policy review, we need no additional steps from you at this time. When your application is assigned to a licensing specialist, you will receive information to log in to connect with instructions for how to do that. So if you're on the wait list or your application is currently under policy review, no action is needed from you at this time. If your authorized contact has sent in the information, we ask that you be patient. We are manually processing all of these requests for every provider. And if it has been a significant period of time, I would make sure that the authorized contact is checking their spam inbox. We're receiving a lot of notifications that temporary passwords to log in to connect were sent to spam. So if you sent us the information and you have not received a login request yet or the temporary password yet, please make sure that you are checking your spam inbox to make sure that it has not gone there. Thank you.
Thank you, Emily. So let's just, again, review those steps. Right here, you can see that we're looking at a website, and you will notice the red box in the middle there is really just addressing the licensed provider, and that you would actually request login. So you can see the button below. Now remember, this is a website, so you're going to need an internet browser. We support all browsers for the provider. So whether you're a PC user, you can use Google Chrome, you can use Microsoft Edge, or if you're a Mac user, you can use Safari. All of those will work. And then when you request that login, that's when you're going to wait. And I'm specifically talking to the main authorized contact, who will do this first time you get into the portal for the provider. That's the step we're talking about right now. Okay. When you do first log in, because we do want you to know critical information, we indicated 3 particular videos that are required. And so we do request that you watch these videos. They're specifically around the corrective action plan process, as well as renewals, which may be very critical at the time that you log in. And we'll show you how to find that information when you get in the portal. So those, once you download and view those videos, they're always available to you. You're going to see there's many more than these 3, but these are the 3 we require up front, that you actually, as the first time user, log in and watch these videos. And then the next step in the next slide shows, then you just really just attest that you have watched those videos, and then you're good to go. Once you click next here, the system will take you, log you out, but now you're ready to log in with your username, which is always your email address, the password that you set up, and now you can click login, and that'll be your day-to-day way to get into the portal. You can bookmark your website and make sure you save your password. There is a password reset as well. So now let's go into the portal and see what you will see. And the first thing you're going to see is your dashboard. So there's a landing page, and this is really, as again, this is just a week of setting up providers. So we know some of you are main authorized contacts for multiple provider organizations. So you might have more than one provider here on the dashboard. So this is a landing page. But this is a typical setup here. We're going to click on dashboard. And once you get into the dashboard, you're going to be able to see for this provider all the information that you need to see that is housed by our Office of Licensing system, our database. And so as we scroll, and you don't see the scroll, but there's a scroll bar, you're going to be able to first look at the Communication Center. The Communication Center is set up for you to be able to communicate with the Office of Licensing, and also the Office of Licensing can communicate with you as a provider. So in particular, you will get renewal notifications, you'll get license report that when they're issued, will send you a notification. Now, the good thing is, because we know you're not going to be in the portal every day, the Connect system will send to the main authorized contact a notification that there's something waiting for you in the portal with a link for you to log in. There's also a messaging. Messaging is different than your correspondence inbox. That correspondence inbox is mostly what we will be sending to you for notifications. Messaging is where you can communicate with the Office of Licensing. So you can send a message to your licensing specialist around anything that is of concern or a question. And then you have your login requests, and that's more for the authorized users who are managing your users, because once that first provider user is set up as the main authorized contact, all additional requests to log in for your provider portal will be routed to your main authorized contact, and you'll be able to see the requests right there. So we're going to scroll down to see what else is available on the dashboard. So you have a suite of menu options depending on what you're licensed for. And that first link right there, main authorized contact, is going to be one of the first activities we're expecting you to do. But as you can see, children's residential provider application, background checks, service mod, location modifications, license renewals, corrective action plans, all of these links represent functionality that's available to you through the provider portal. You can go to the next slide. If you want more, well, I'll get to that. There's a way you can hover and find out more about those menu links, but we'll look at that in a second. As you scroll down, you also get to see all of your active licenses. So you can see, in this case, an org license for the provider, a service license, or many service licenses that you might have. Your description, your license number, and then the period of that license, whether it's annual, triannual, you'll have that period. And you can see in this example how the renew button will become available within 90 days of license expiration. So not only will we remind you through a notification correspondence, but the renew button then becomes available on that 90th day prior to your license expiration. There's provider owner information down there below. You can also set up additional contacts. All of that is what you will manage under your provider manage additional users, which we're going to look at next. And then the last part of the dashboard is really the suite of provider portal training that we have prepared for you. We know that there's a lot of functionality that is available in this portal. And so we want you and your users, depending on their role, to take this training and to learn how to use the provider portal. So let's get into how do I manage additional users? This is, again, once you as the main authorized contact are in the system, we're going to expect that you're going to want to set up additional users. So let's watch a video.
To manage additional users for the Connect Provider Portal, navigate to the menu on the dashboard screen and select Manage Authorized Contacts. You will only be able to select this link if you have all access security within the provider portal. The contact screen includes all of the contacts for your organization currently on file with the Office of Licensing. You can manage the contacts on file by adding new contacts, editing the contact information on file for existing contacts, editing whether a contact has access to the provider portal and what level of access they have, or removing contacts that are no longer associated with the organization. Please note that if you click to remove a contact, there is no warning or confirmation screen. The contact will be removed upon clicking the Remove button. To manage which contacts have access to the provider portal and to set or change the level of access, click the Select button in the Edit Access column next to the contact to manage. This screen allows you to grant access to the user for the provider portal and choose the level of access the user will have. Users can be given any combination of access levels to the provider portal. All access allows the user to perform all functions available from the provider portal dashboard. This includes all access levels listed below, as well as the access to add and manage authorized contacts and reset passwords. This is the highest level of provider portal access. Renewal access allows the user to access the function of submitting licensure renewals. Modification access allows the user to access the functions of submitting various modifications, like adding new services, adding new locations, or changing license and organization information. Corrective action plan access allows the user to view and respond to corrective action plans. Background check access allows the user to add and manage background check contacts, view the status of submitted background checks, and view decision letters sent by the agency. This access should be restricted to designated background check contacts only. To grant access to the user, update the provider portal access field to Yes. Choose the level of access, then click the Save button. Once you click Save, an email with a temporary password will be sent to the contact, and they will be invited to sign in to the DBHDS Connect Provider Portal dashboard. The temporary password will expire in 48 hours. If a user forgets their password and needs assistance resetting it, or if a user's temporary password expires, a button will be available at the bottom of this screen to send a new temporary password.
Thank you. So the main authorized contact, again, the first step, once you are fully in the portal, would be to review your main authorized, you as the main authorized contact would review what's under the authorized contact menu link. What will come over is all of the authorized contacts that we had in our legacy OLIS system. And so you want to go through and make sure that those people are still valid to be users of the portal. And then you still have to turn on their access. So even though they're sitting there, you still have to, just like that video showed you, you have to edit and give them access to the portal. And then that will generate an actual invitation to them with a temporary ID so that they can log in. Thank you. Any of these menu items, and including the first one that most likely you're going to access, has a little hover there. And I want to just show you that there. You can see how when you hover with your mouse over that question mark on any of those menu links, it's going to pop up and give you real specific information of what do you do in that particular menu. So again, just really supporting you so that you can kind of follow the trail. Yep, thank you. So let's talk about background checks. And we do have 2 videos for you to watch.
The DBHDS Connect Provider Portal dashboard allows you to register with the Background Investigations Unit and manage your background check contacts online. Only those users with all access or background check access can select the background checks option from the menu on the Provider Portal dashboard. The security is restricted to these groups because the eligibility letters sent by the Background Investigations Unit often include sensitive and confidential information about individuals. To manage background check contacts, choose the Background Checks option from the menu. The background check status screen will display all individuals who have submitted fingerprints to FieldPrint in the last 60 days. It will include information for the status of the background check decision, as well as a link to the eligibility letter once it is issued. Click Manage Background Check Contacts. Any contacts registered with the Background Investigations Unit for your organization will be displayed on this screen. Contacts can be edited or removed, and new contacts can be added. It is important to note that if you click to remove a background check contact, there is no confirmation page. The contact is removed upon clicking the Remove option. If a contact is removed by mistake, they will need to be added again. Background check contacts listed on this screen indicate who eligibility letters are sent to. This does not grant access to the provider portal. These contacts must also be added as an authorized contact with provider portal access and background check level access in order to view the status of background checks and eligibility letters on the DBHDS Connect Provider Portal. To add a new contact, click the Add New Contact button. This screen asks if the contact to be added is for the organization or for a specific location. If background checks are managed by one person for your entire organization, select Contact for Provider Organization. If background checks are managed by different people by the various locations of your organization, select Contact for Location, then choose which location or locations the contact manages. Please note that there can only be one contact for the organization and for any given location. If your organization already has a contact for the organization or for a location and you add a new one, that contact will be removed and replaced by the new contact added. Throughout the next screens, you will be guided to search for an existing record in the Office of Licensing database for the contact to be added. If a record is not found, you will create a new record for the contact. Upon completion of these steps, the contact will be added to your organization and assigned a contact ID. The DBHDS Connect Provider Portal dashboard allows you to view the status of background checks and eligibility letters online. Only those users with all access or background check access can select the background checks option from the menu on the Provider Portal dashboard. The security is restricted to these groups because the eligibility letters sent by the Background Investigations Unit often include sensitive and confidential information about individuals. To view the status of background checks, choose the Background Checks option from the menu. The Background Checks status screen displays all individuals who have submitted fingerprints to FieldPrint in the last 60 days. Background checks will display on this screen the day after the FieldPrint appointment. Background checks will display as pending, record being processed, or record being researched, while the Background Investigations Unit is waiting for the record results and investigating records. Pending background checks will not have the decision or a link to the eligibility letter. Once the background check results are received and reviewed, the status will be updated to completed, the decision will display, and the eligibility letter will be available.
Thank you. So your background check context will be transferred into Connect from FieldPrint, and what you will need to do is, again, just like you will your contacts, your authorized contacts that were in our legacy system, verify, update, remove anyone that is no longer a background check contact. Most importantly, you still need to give them access to the portal. It is not automatically assumed. So their setup requires that you give them access to the portal or add them as a portal user, and then you also set them up to be a background check contact. If you go to the next slide, remember you can do that at the org level, or you can do it location by location. Just remember, only one can be identified per location or org. So those are, if we just pause here, everything that we've covered up to now, from you as the main authorized contact getting into the portal, you as the main authorized contact getting, reviewing and managing your portal users for your organization, and then getting your background check contact set up, is the main three key activities we expect from the provider at this point. What we're going to look at next is just the other functionality that's available to you and still may be critical for you to be in action around. We just will not be doing a deeper dive at this point. We will talk about additional training that we're going to really ongoingly have available, and we'll talk about how do you make sure you're notified at the end of this session. So let's talk about license renewals. There is a menu option that is for license renewals. So we've talked about this already. 90 days prior to that license expiration date, you will get a renewal notice in your communication center. What you will also get, and go to the next slide, please, is next to that, so this is the communication center. There's your renewal notice addressing what you can do, and you'll get an email telling you that the renewal notice was arrived in your communication center for you to log in and read it. And then the next slide will actually show you what happens on your dashboard against that license. Once it sees we're within 90-day window, there's going to be a renew button. And it really is just that simple that you can click on it. You can associate your current SSC standing, and you can submit your renewal online, and that will be received by the Office of Licensing. Another feature that is available now is the print license feature. So if your license requires a new wall certificate upon renewal, you're going to be able to get into this print license and print your wall certificates. You'll also have access to your addendums as part of your license that you can also print. So no more mailing wall certificates from the Office of Licensing. We've now removed that requirement. Next slide. Let's talk about service modifications. Service modifications, we talked about already, are now in 4 discrete, yep, you can go to the next slide. Thank you, Tanya. So we have a service modification that is like the overall kind of bucket of modifications you were used to, but now we've kind of organized it into 4 discrete types of modifications. So now a service modification actually means you want to add a new service. A location modification means you want to add an additional a service location to a license that exists. An information modification means that there's some miscellaneous information, maybe bed capacity and other things that might need to be changed, but it usually does not impact the license, but you need to be able to tell us so we make those changes as well. And then there's a corresponding children's information mod, which is appropriate if you are licensed for children's residential. What happens, let's say if you said service modification, because we know that might be an activity coming up with all the changes out there, you would click on service modification, and here is where you would select what is the service and program that you want to add. And all of our services are listed here. So you would select one, and then the next screen would actually identify for you what are the requirements. There's actually a checklist. So Connect is smart in knowing, even as you're requesting a service modification, you want to add a service, and then there's a set of documents and requirements that you must go through to be able to submit. So it won't let you submit the service modification until you pretty much have at least all the key requirements set up here. And it just walks you through and gives you your checklist of what there is to do. And then on the next slide, we'll just show, so any types of documents of evidence of staffing plan, working budget, all of that is all built into the solution so that you can do everything online. And then when you're ready, you would submit your service modification. Corrective action plans. So now all corrective action plans will be issued through Connect, will be available through the provider portal. So you'll get an automatic email when the licensing report has been issued. And you're required to log in and complete the corrective action plan if there's citations as part of that licensing report. You'll still get a licensing report even if there are none. You'll see an example of that in a minute. The other nice thing you'll get is an alert if 3 days before that cap due date, when it's due, if you have not responded, it will alert you that it is due. When you click on that corrective action plan menu, this is what you will see. Of course, for our senior providers who've been with us for many years, we have 10 years of reports that will be out here, and you will be able to see what's complete with no violations, reports that have been through the citation process and approved. And of course, when you're newly issued, that's how it would look. It would look like it's issued with a date, but you would have gotten a notification as well as a communication correspondence in your communication center. So we're going to click on that view cap for the issue to just show you the functionality that's available there. Up at the top, you can see you can print your cap. So most likely, especially once it's final and approved, you may want to keep a paper documentation, and you can do that. You can see the various links there. I'm just highlighting, again, we're not going to do a deep dive here, but viewing your HIPAA form, your medication HIPAA form, all of that now is online. You will not have to, unless it's a special case, receive that in email from your licensing specialist. And then over to the right there, you can see that when you're ready to respond, you're going to enter responses. One of the things Connect, again, is really making sure that you complete the citation fully. So at the bottom there, you can see that it expects that there'll be a response to every citation before it will allow you to submit back to the Office of Licensing. And there's more to this, right? So you submit your response, it's reviewed by the Office of Licensing, and again, we're going to come back and revisit this topic in a deeper way in the future. But there's also, those are the, it's covered also in the videos that we provided. So to give you kind of a advance, if you need to know now, you have access to those videos. Thank you. Just another thing, especially when you go to a printed cap or really printing any reports in Connect, you may bump into a pop-up blocker. Because this is common, we have set up the steps for you on how to disable your pop-up blocker if you're Google Chrome. You may run into it with Safari and there's a different steps, but you just want to make sure that you've enabled the website so that you can print things from the portal. So that again is our first introduction, our launch to you as the provider to join us in the Connect Provider Portal, initiate doing business with us online. We're just going to review a few things just to cover what you can expect next. And mostly, and then we'll take some time for questions. So we'll do the next slide. We have set up a help desk for providers specifically, so that if you find after you've done your training and after you reviewed and you've walked through the steps, you're finding there's some technical difficulty that you can't work through, we have set up a help desk for you to call. It is, you can see the hours of operation and it's available to you, and you as a licensed provider will be supported. So your next actions after this is to make sure, if you have not, send in your main authorized contact. And if you know you've done that and we're good to go here, then you're really just waiting for the invitation to log into the portal and get authorized. When you get that invitation, you'll go to the website that it'll drive you to. You'll click the request login, and within 3 to 5 days, you're going to get a temporary password sent to you. And when that temporary password is sent to you, you can go to the portal and just log in, set yourself up, review the trainings, and you're good to go. Start managing any additional users and getting your background check set up. We will offer, I'll just go back 1 second, Tanya, thank you. We will offer additional training. We're looking at when, but what we really highly stress, as we always do, that you're registered in constant contact so you can receive the training invitations for Connect. And then also, yep, that's all. We covered all of that. Thank you. So we're now going to just pause for just a few minutes, and for Emily, just going to review some of the questions that have come in. And then there are some questions we have prepared that we know have been asked by other providers. So we're going to just take a few minutes and then we'll go through the Q&A. And if there's any questions also that you want to submit as well, you can do that.
Thank you so much, Robin. So we will start to go over some of the frequently asked questions from our other trainings, and hopefully these will address some of the questions that you have. And if they don't, we're also going to answer as many questions as we can at the end of the training. So the first question is, can a provider have more than one main authorized contact? The answer is no. The provider can only identify one main authorized contact who will be granted all access. However, the main authorized contact can set up additional users to also have all access. The main authorized contact can be changed by the provider at any time. So yesterday we received a question that said, if I'm the main authorized contact and I'm going to be on leave for 2 weeks, can I assign someone else in the system to be the main authorized contact in the interim? And yes, you can make temporary assignments to be the main authorized contact as long as that person has all access. Changes can be made at any time related to the main authorized contact. We had another question that said, is there a limit to how many Connect users an organization may have? No, there is not a limit to how many Connect users an organization may have. If you're a large organization and you have 30 people that need access to the Connect system, you can grant access to 30 people. The third question is the provider number displayed in the portal the same as the license number? Yes, the provider number that displays in Connect is the 3 or 4 digit organization license number, and it is the first portion of the service license numbers. So I think we received some questions from people who are wondering what they should submit, what their authorized contact email. I put the information in the chat, but it's going to be the first 3 or 4 digits of your license number. So if you're an older provider, it's more likely that you'll have a 3-digit organization number. And if you've been around for a little bit of time or for a while, but not for decades, it's more likely that you will have a 4-digit organization number. So you'll see here in the slide, it's the first 3 to 4 digits of the full license number printed on your license. The fourth question is, will you be notified when you have correspondence and connect via email? Yes, email notifications will be sent to the main authorized contact anytime there's a new message or correspondence on the provider portal dashboard. The notification will direct you to sign into the portal to view the new message or correspondence. Any person who has access to the communications portal will be able to review the correspondence. So even if you are not the main authorized contact, whenever you log into the Connect system, you have the ability to review and respond to messages in the communication portal. So you're not going to get a message prompting you, letting you know, you're not going to get an email prompting you to let you know that a message is in the portal. But if you're signed into the portal, you will be able to see messages and respond to them no matter what your access is. We received a lot of questions about what would be changing with the field print process, if anything. And everything concerning the field print process will remain the exact same. So for background checks, any type of the process that involves field print will remain the same. Another question was, does the Connect portal provide any service regarding central registry searches? And the answer to that is no. There is no interface between DSS and Connect for central registry searches. So information will still need to be sent to DSS in order to receive central registry search results. Someone said, where will the training videos be located for review? All provider training videos are available to Connect portal users from the provider dashboard. All users must view the required training videos indicated by the asterisk upon their first login. Someone said, what can you expect now that you attend the Connect portal training? Once again, we go back to one of those first slides where if your provider has already identified the main authorized contact and submitted the contact information via email to DBHCS, an invitation to log into Connect will be sent to the main authorized contact. The main authorized contact should follow the link to the Connect portal and click the Request Login button. They will receive a temporary password, and once they're logged into the Connect system, they can begin to add additional users that are not the main authorized contact. So that is it for our frequently asked questions, and we'll begin to talk through some of the questions we received during this training. So we received a question that said, will this PowerPoint presentation be emailed out or available? And the recording PowerPoint will be posted on our website within the week. The PowerPoint itself was sent out to all providers and should be posted on the Office of Licensing website by the end of the day. So we sent out the PowerPoint, I believe yesterday morning, yesterday morning to all of our providers. If you did not receive it, I encourage you to go to the Office of Licensing website and sign up to receive constant contacts. That is the mode by which we send all of our communications to portals. So if you didn't receive the training, I would take this opportunity to log on to our website, sign up for constant contact. The PowerPoint should be available on our website by the end of the day. And we will also have a recording of this live training itself within the week. Someone asked, they said they were on the waiting list and asked how they could track where they were on the wait list. The wait list will be available to view in the near future. And we also want to note that the wait list may not be processed in chronological order, as state initiatives may cause prioritization changes and the order applications are reviewed. Someone said, until agencies receive full access, how do we go about receiving background check results? You will not be able to access your background check results until you have been given access. So it's critically important that you send the authorized contact information to our office if it has not been sent already. And if you have received that login request email, to log in and look for your temporary password. Someone said background check contacts our employees, correct? And no, the background check contact should be the person who's responsible for receiving the criminal background results for the specific licensed organization. Someone asked, they just wanted to make sure that they heard correctly that there can only be one contact person for background checks. And yes, that's correct. We had a question about outpatient therapy. The requester said outpatient therapy office locations no longer need a location modification. Is that correct? And yes, that's correct. School-based outpatient therapy office locations no longer need a location modification. We received questions about central registry searches, and I know we talked about it in the FAQ, but just to be clear, there's no interface between DSS and Connect. So central registry searches, that process will not be changing. We received a question that said, what is the help desk number again? If you have completed a training, and which all of you have, and you have submitted the information to be an authorized contact and received your temporary password, you can contact the help desk, which is 804-215-2190. And we can also put that in the chat as well. That phone number is in the chat. Someone asked, will past caps be available or just caps going forward? All previous caps will be available within the provider portal. Someone said, can we still submit renewals through email or US mail? No, the Office of Licensing is officially paperless and all work functions will occur through the Connect Provider Portal. The one caveat to this is people who are currently under policy review, they will continue to submit their revisions through the USPS. But any licensed providers will need to submit their renewals, their modifications, their corrective action plans through the Connect system. Someone asked about the timing for providers to submit or start using the system. Once you receive the temporary login and you are set up in the system, you can start to use the system at any time. If you have received the login request email from our agency and you are having a hard time and receiving the information, the provider record enter does not exist, please contact the help desk. Someone said for background checks, will they include the report that shows activity even if they're eligible so we can verify disclosure? At this time, if you receive a status of an individual is eligible with the VSP record, you will be able to print the eligibility letter. However, we will still be mailing out the actual report to you via USPS. Unfortunately, those records are taking 3 to 4 weeks due to a technical difficulty. So you will receive notification in the Connect system, but you will also receive the letter via the USPS as well. Someone said, how do I set up my provider account so that my organization number is found in FieldPrint? We are pending license and assigned to a licensing specialist. We have to initiate background checks before we can be licensed. If you are someone who has been assigned to a licensing specialist by a policy review specialist, you will have received information regarding access to the portal. You will receive information regarding access to the portal. After setting up your account, you will be able to schedule your FieldPrint appointments. So someone asked if all access users will also receive email notifications that there is a message in the provider portal. Unfortunately, this is not a function of the Connect system yet, but we know that this is something to providers, and so we are working to determine if this is a possibility in the future. So unless you are the authorized contact, you will not receive an email saying that there is a communication in the portal. If you log in, you will still be able to see the communication. Someone said that they are having issues getting logged in. If you're having issues, please send an email directly to the admin inbox, please. Someone says, does the Connect provider portal provide user with access to submit claims? No, there are no billing mechanisms through the Connect provider interface. Someone said, until we have access, how do we request to add a location to our license? This cannot be processed until you have access to the Connect system. So we encourage you to submit the necessary information, and we are working as quickly as possible to manually upload people into the system. Someone asked what the website was to access the Connect provider portal. We individually are sending links to the authorized contact for each organization. And once they are enrolled in the system, they can send that link out to organization staff. We received another message about someone who's having an issue finding their provider name and the request login page. If that is your situation, I suggest that you call the help desk. The phone number is 804-215-2190. And I just wanted to say that the formal presentation is over. So if you don't have any additional questions, you're more than welcome to log off. We're just focusing on making sure we can get questions answered for those that do have them. Someone asked if there's a deadline for when all of the contact people have to be entered for the portal. No, there's not. You can add as you see fit. We received another question about initial applications. New applications will be submitted via Connect. Please stay tuned on our website for information on how to access the new application function. Someone asked about payment for background checks, and whatever payment process you have set up with FieldPrint will remain the same. Someone asked, can new service providers that are submitting applications this month still send by mail? No, the Office of Licensing is no longer accepting paper applications. So we are no longer accepting paper initial applications, service modifications, renewal applications. Someone said if registration for the training was enough, was what was needed to register in the Connect system, and no, those are two separate processes. The turnaround time for login is 3 to 5 business days. Someone said, can you access the Connect system without first being licensed? If you are on the waiting list, no, you will not. We are uploading your application from the back end, and when you are pulled off the waiting list, you will receive notification from your policy review specialist for instructions on how to get into the system. We're receiving several questions about billing. There is no interface related to Connect and billing. So in order to bill, you still need to follow the exact same functions that you always have. Okay, so we're continuing to receive questions about initial applications. Initial applications will be submitted via Connect to the Office of Licensing website. The Connect link for initial applications is not live yet, but please continue to visit our website and the link will be available within the upcoming weeks. So initial applications will be submitted through Connect, but that function is not available yet. So please continue to look back on the Office of Licensing website for when it does become available. So someone asked what the waiting list was. The waiting list is the list for initial applicants to be pulled off of the waiting list. So for people who have applied to be licensed providers who are waiting to be reviewed by policy review specialist. So we received a question about service authorization through the Connect system. Connect will not be processing service authorizations. Please continue to follow processes related to billing as you have. This does not change any billing requirements. There were questions about timelines for service modifications and licensing processes. I would encourage anybody who has questions to review the October 5th memo related to Connect and timelines for Office of Licensing processes. That's on the DBHS Office of Licensing website. And I believe that one of my colleagues can also put the link to that memo directly into the chat. So please review the October 5th memo related to Connect and Office of Licensing processes for additional information related to timelines. So we received a question that said who the invitation will be coming from. So the process is when we receive the authorized contact information, you will receive, we will process that, and an email address will be an email will be sent from licensing admin support at dbhcs.virginia.gov. That email will have the login link to connect. You will log in, and we will receive that request. You will then get a temporary password to log into the system. Turnaround time is 3 to 5 business days. What I can say, as someone who has been manually processing these requests, we received several emails that did not include the required information, which slows down the time. So 3 to 5 business days for the process to be completed. When we are turning around the request for a temporary password in about half of a business day. So I would say that if you have submitted the authorized contact information and you have received the link to submit a temporary receive a temporary password, if you haven't received your temporary password, please check your spam box, because those are being processed very quickly. Someone said, will the central registry form be received the same way? There's no interface between Connect and the DSS central registry search. So central registries will continue to be processed in the exact same manner they always have. I have included in the chat the memo related to Connect and timelines for processes. So for those who had questions about service modifications, please review that memo. Okay, that's going to conclude the question and answer portion for today's training. There are a few technical questions that we're going to need to touch base with our developers, and we will be working on providing answers in writing to all of their questions received during all 3 trainings to participants. So please stay tuned for that. We appreciate your time, and we are more excited than ever to be entering into this new chapter with Connect. So thank you again, and we look forward to working with you.